On December 30, 2025, a decision reverberated across the nation. The U.S. Department of Health and Human Services, often referred to as HHS, announced an immediate freeze on all federal childcare payments to the state of Minnesota. This unprecedented move marked a turning point in the relationship between federal agencies and state-run childcare programs. For many, it was a day that would not soon be forgotten, as the news sent ripples of uncertainty through communities, government offices, and families alike. The drastic action was prompted by a series of alarming allegations. Reports had surfaced, suggesting widespread fraud and financial misconduct involving a significant number of daycare centers across Minnesota. Investigators, both local and federal, descended on facilities, searching for evidence and interviewing staff. The scale of the alleged wrongdoing was staggering, with authorities suspecting a sophisticated network that had siphoned off funds intended for the state's most vulnerable children. At the heart of the scandal were millions of dollars in government aid. These funds, earmarked specifically to support childcare for working families, were allegedly diverted for personal gain or misused in ways that left many children without the care they desperately needed. The sight of empty playgrounds and shuttered daycare centers became a stark symbol of the crisis as parents and providers grappled with the fallout. The freeze sent shockwaves through Minnesota's communities. For thousands of families, childcare is not a luxury, but a lifeline, essential for parents to work and children to thrive. Suddenly, that lifeline was in jeopardy. Parents gathered outside closed facilities, anxious and uncertain about what the future would hold. Community meetings grew tense as families demanded answers and reassurance that their children's well-being would not be sacrificed. In a series of press conferences, federal officials, including HHS Deputy Secretary Jim O'Neill, addressed the public. They emphasized the gravity of the situation, underscoring the importance of safeguarding taxpayer dollars and ensuring that federal funds are used as intended. O'Neill spoke candidly about the breach of trust, vowing that those responsible for the fraud would be held accountable and that the integrity of the child care system would be restored. Behind the scenes, teams of auditors and investigators pored over financial records, tracing the flow of funds and identifying irregularities. The department's decision to halt payments was not taken lightly. It signaled a demand for full transparency, a comprehensive audit, and a commitment to reform before any federal dollars would resume flowing to Minnesota's child care providers. Now all eyes are on Minnesota. State officials, community leaders, and families are working together to rebuild trust and ensure that public funds reach those who truly need them. The path forward will require vigilance, collaboration, and a renewed dedication to the children and families at the heart of this crisis. The federal investigation that would soon grip the nation was set in motion by a single, explosive viral video. In an age where information travels at lightning speed, it only took a few hours for the footage to spread across social media platforms, news outlets, and community forums. The video's impact was immediate and profound, raising questions and concerns from parents, lawmakers, and the general public alike. The video was produced by independent journalist Nick Shirley, who had been investigating rumors of irregularities in local daycare funding for months. Armed with a camera and a determination to uncover the truth, Nick documented what he found and shared it with the world. His footage revealed a troubling pattern. Daycare centers, such as the Quality Learning Center, appeared completely empty during operating hours, yet records showed they were still receiving substantial government funding. The images were stark. Rows of unused cribs, silent playrooms, and locked doors where children should have been learning and playing. The undeniable visual evidence left officials with no choice but to confront the possibility of widespread fraud. The video circulated rapidly among government agencies, prompting urgent meetings and heated discussions about accountability and oversight. As the public became aware of the situation, outrage grew. Parents demanded answers, advocacy groups organized protests, and the media descended on the story, amplifying the pressure on authorities to respond decisively and transparently. In response, the Department of Health and Human Services launched a comprehensive investigation, using Nick Shirley's video as the starting point for a much deeper probe into the state's child care funding system. investigators began reviewing financial records, interviewing staff, and visiting facilities to verify the claims. This unfolding case demonstrates the crucial role that independent journalism can play in holding institutions accountable and shining a light on issues that might otherwise remain hidden. Without Nick's persistence and willingness to ask tough questions, the alleged fraud may never have come to light. Ultimately, one viral video set off a chain reaction, galvanizing a community, prompting government action, and potentially reshaping the future of childcare funding in Minnesota and beyond. The story is a powerful reminder of how a single voice, amplified by technology, can spark meaningful change. At the heart of the scandal are millions in federal funds meant for Minnesota's childcare. HHS allocates about $185 million annually to support around 19,000 children. Allegations suggest a significant portion was funneled to non-existent or non-operational centers. Each misused dollar is a loss for families who depend on this support. The scale of the alleged fraud raises urgent questions about oversight and accountability. As investigations continue, these figures highlight the need for rigorous checks in government aid programs. Minnesota's response to this financial crisis will shape future policy and enforcement. In response to the viral video, the federal government acted swiftly. HHS Deputy Secretary Jim O'Neill condemned scammers exploiting the system for millions. The freeze is backed by evidence, video footage, attendance discrepancies, and licensing irregularities. HHS demanded a comprehensive audit of implicated centers, covering licensing, inspections, and complaints. The freeze is temporary, contingent on Minnesota's cooperation and transparency. New nationwide policies now require states to justify payments with photographic evidence. These reforms aim to strengthen the integrity of federal assistance programs. HHS's decisive action sets a new standard for handling such allegations. Minnesota's response to the payment freeze has been a complex blend of criticism, concern, and a willingness to work with federal authorities. The state government, local officials, and community members have all voiced their perspectives, reflecting a wide range of emotions, from frustration over the disruption of vital services to determination to address the underlying issues. The payment freeze has put a spotlight on Minnesota's systems for managing public funds, and the state's leaders are under pressure to demonstrate both accountability and transparency. Governor Tim Walz's office responded swiftly, calling the HHS decision a political move that unfairly targets Minnesota. At the same time, the governor emphasized that the state has already taken significant steps to strengthen anti-fraud measures and improve oversight of public programs. Walz's administration has pointed to new policies, increased audits, and closer monitoring of providers as evidence of their commitment to protecting taxpayer dollars. State officials have repeatedly stated that they are dedicated to restoring public trust and ensuring that families who rely on these programs are not left behind. They acknowledge that mistakes were made, but stress that Minnesota is actively working to correct them. Community leaders and advocacy groups have also joined the conversation, urging the state to prioritize transparency and communication with the public. Despite ongoing tensions and public disagreements, Minnesota is cooperating with federal audits and reviews. State agencies are providing documentation, opening their books, and working closely with federal investigators to address any concerns. This spirit of cooperation is seen as essential for resolving the payment freeze and moving forward. For many families, the stakes are high. The freeze has disrupted access to crucial support services, and state officials recognize the urgent need to resolve the situation. By working with federal partners, Minnesota hopes to restore funding and ensure that vulnerable children and families receive the help they need. The situation has exposed the complexities of federal-state relations, especially when public trust and the well-being of families are at stake. Navigating these challenges requires careful negotiation, clear communication, and a shared commitment to accountability. Minnesota now faces the difficult task of defending its practices while also addressing any failures that may have allowed fraud to occur. The state must show that it can learn from past mistakes and implement meaningful reforms. Ultimately, the outcome of this investigation will have lasting implications for how Minnesota manages public funds, oversees social programs, and maintains the trust of its citizens. The lessons learned here could shape the future of public administration in the state for years to come. In response to the scandal, HHS has rolled out new safeguards. States must now provide detailed justification and photographic proof for each child care payment. A new public hotline encourages citizens to report suspected fraud directly. HHS also requires a thorough audit of implicated daycare centers, reviewing records and complaints. These reforms aim to close loopholes and prevent future abuses. Stricter oversight is now the standard for federal child care funding. The approach not only addresses Minnesota's crisis, but sets a precedent nationwide. HHS is determined to restore public confidence in government assistance programs. The payment freeze has real consequences for Minnesota families. Many parents, especially in lower-income households, depend on government-assisted childcare to work. The suspension threatens the availability and quality of these services, leaving families in limbo. Daycare centers face uncertainty, risking closures and reduced care quality. The scandal erodes public trust in both state and federal systems. Restoring that trust is now a top priority for authorities. The crisis highlights the need for strong oversight to protect families and public resources. Ensuring funds reach those in need is essential for community stability. Restoring public trust is now central to Minnesota's recovery from the daycare fraud scandal. State and federal leaders must act transparently and decisively to rebuild confidence. Collaboration and clear communication are key to implementing corrective measures. Community involvement through reporting and oversight strengthens accountability. New HHS policies, like photographic evidence and a fraud hotline, aim to reassure the public. The lessons learned will shape future management of federal aid. Transparency and vigilance are essential to protect vulnerable families and restore faith in public programs. The Minnesota daycare scandal is a stark reminder of the need for vigilance in managing public funds. Authorities are focused on a comprehensive audit, increased oversight, and new transparency policies. The public is encouraged to stay informed and report suspicious activities via the HHS hotline. Community engagement is vital to maintaining program integrity. The scandal's lessons will influence childcare funding policies nationwide. By prioritizing transparency and accountability, trust can be rebuilt. Robust oversight is key to preventing future fraud. The public's role in safeguarding resources has never been more important.